Well, now I'm very pleased to say that South Australia's Minister for Health and Wellbeing has made the time to be with us today, which is absolutely excellent. The Honourable Chris Picton is joining us to give today's welcome and opening address. He is the member for Ghana in the southern suburbs of beautiful Adelaide. He's previously served as a Minister for Police, Correctional Services, Emergency Services and Road Safety. Huge. Before his election to Parliament, he served in roles that were very relevant to today's conversation as Senior Advisor and Chief of Staff to former state and federal health ministers, so health ministers, and Associate Director at Deloitte Access Economics. His areas of policy work included tobacco plain packaging, huge, national public hospital funding, huge, and the reforms thereof. And so we give a very warm welcome to the Minister. Thank you so much for being here.
Look, thank you very much. And firstly, can I acknowledge that we meet on the traditional lands of the Kaurna people and pay my respects to elders past, present and emerging. Can I acknowledge John Allen and Dave Peters, the co-chairs of the Alliance, Professor Russell Roberts, the Equally Well National Director, but all of you who have come from around the country to be here as part of this important conference. Yesterday we had some sad news that Adelaide is not going to be hosting COP, but at least we are hosting the Equally Well conference here in South Australia for the first time, which is more important, exactly. Now, welcome to day 2 of the conference, and it's wonderful to see so many of you here, researchers, clinicians, advocates, policy leaders, and importantly, people with lived and living experience. And I want to begin by recognising the extraordinary work of the Equally Well Australia. You've created a movement that stretches across governments, services, regions and disciplines, all united by a shared purpose: to improve the wellbeing and the life expectancy of people living with mental health conditions. Since governments first formally committed to the Equally Well National Consensus Statement in 2016, the movement has grown into a powerful national collaboration, one that elevates lived experience, strengthens evidence-based practice and shines a light on unacceptable life expectancy gaps. And thank you for choosing Adelaide to have your conference. We are here because every life cut short is a story unfinished in a family forever changed. Across Australia, our collective effort can rewrite these stories. And we know that the inequalities are stark. People living with mental health conditions experience poorer physical health, barriers to care, and significantly shorter life expectancy. The national data tells us that these lives are being shortened by 14 to 23 years. We know that people living with mental illness are twice as likely to experience chronic physical conditions, 56% more likely to smoke, and 6 times more likely to have dental issues. As the Equally Well Consensus Statement reminds us, Aboriginal and Torres Strait Islander people already face a 10-year life expectancy gap, which widens even further for those living with mental illness. And when a person's cultural identity and integrity is disrupted, culturally grounded responses aren't optional, they are essential. A holistic approach built on lived experience and cultural understanding is the only way to deliver care that truly heals. These aren't theoretical challenges. These are real people, real lives, real communities, and that's exactly why Equally Well matters. And Equally Well is more than a policy platform, it's a roadmap for a healthier, fairer future. It calls for care that is connected, preventive and whole. Its goals are clear: to close the life expectancy gap, to make physical health inseparable from mental health care, to strengthen cross-disciplinary partnerships and to turn evidence into practical solutions that change lives. And SA Health is proud to support the National Consensus Statement. It's embedded in our state mental health services plan, backed by ongoing work and grounded in a long history of collaborative action. The South Australian Government is committed to transforming research into real-world change built on decades of that groundwork. It goes back to 2008 when we launched a mental health-led metabolic health action plan, supported by online health promotion tools and multidisciplinary collaboration across services. This work helped embed consistent physical health assessments, including weight, waist circumference, blood pressure across our mental health services. The message was clear then and remains clear today. Physical and mental health are inseparable. And we've continued this work through strong engagement with general practice, led first by dedicated GPs and more recently through the SA Health GP Liaison Group. This group brings together GPs, mental health clinicians, lived experience leaders to champion shared care and promote equally well principles. Through education sessions, learning forums and cross-sector collaboration, we're strengthening integrated care at the front line. And last year, SA formed a statewide equally well and general practice shared care working group to drive physical health reform. The aim is to drive change with the same discipline and momentum used on work on issues such as restrictive practices. With membership from lived experience, universities, GPs, NGOs and our local health networks, the group is now supporting local health networks to implement their own equally well action plans, with most of those already underway. And our Chief Psychiatrist is here, Dr. John Brayley, is also working on his physical health standard, currently being refined and headed towards broader consultation. This will support services to meet physical health requirements already outlined in our Mental Health Act. We know that there's more to do, but the foundation is strong and innovation continues to grow. Internationally, the WHO recognises immunisation as a core component to the human right for health. Yet vaccination remains one of the largest and most persistent health gaps for people with mental health conditions. In Australia, influenza vaccination rates remain low among people experiencing mental health illness, and the consequences are serious. We see higher hospitalisation rates, increased mortality, and missed opportunities for prevention. People experiencing frequent mental distress are 21% less likely to be vaccinated. In South Australia, they accounted for nearly 28% of vaccine-preventable hospital admissions last year. Nationally, more than 2,000 deaths occur each year from the flu and pneumonia amongst people with mental health conditions. And together with New South Wales, South Australia has presented evidence to ATAGI advocating for people who experience a chronic mental health condition to be eligible for a free flu vaccination. A New South Wales study has demonstrated that people accessing mental health services were 3.2 times more likely to be hospitalised for vaccine-preventable disease and 2.7 times more likely to be hospitalised for influenza. And the average length of stay for pneumonia is 14 days. But for a person with a mental health condition and pneumonia, it is 19.5 days. This correlates into a potential additional cost of $15,000 per admission. Increased vaccination rate would see a benefit to individuals and families, and the impact on the health system could be enormous. So we will continue to advocate for that national change. Closing these gaps isn't just the right thing to do, it saves lives. Over the past 3 years, the South Australian Government has invested $1.7 billion to expand our mental health services, opening new pathways for treatment and recovery. We're delivering 72 new rehabilitation beds across 3 major new units in our hospitals, embedding in those new units equally well principles into rehabilitation models through exercise physiology, dietetics and physical health programs. And we've strengthened our community mental health teams with $8 million investment. And to see the fruits of these investments equally well must form an integral part of the care that we are providing. Lived experience doesn't just highlight the gaps, it shapes solutions, sets priorities, and keeps us grounded in what matters. And in South Australia, lived experience is not just symbolic, it is central. We provide ongoing funding to support our lived experience leadership and advocacy network, ensuring voices remain embedded in service design and mental health reform. From GP liaison programs to co-design initiatives, shared care models and statewide committees, lived experience leadership continues to grow and continues to guide every decision we make. So when lived experience leads, change is not only possible, it is lasting. Real progress happens when expertise, evidence and commitment converge. Equally Well was one of the strongest examples of this convergence. Every action you take helps to close these gaps. Every effort moves us closer to a system where care is seamless, integrated and fair. Thank you very much for having me, and I look forward to hearing the outcomes of the conference.